Medicare Parts A, B, and D all have deductibles that are set by Medicare every year. Most people understand that if you go into the hospital, there's a deductible that you pay as part of your health insurance. We are used to doing that from having deductibles on our employer plans over the years before we turn 65. But the idea of an outpatient deductible for Part B confuses many people. So in this video, I will show you how the Part B deductible works and how and when you will pay that deductible. Medicare Part A covers your inpatient hospital, skilled nursing, and hospice expenses, and Part B covers your outpatient medical expenses, which is pretty much everything else. Part B provides coverage for doctor visits, lab work, preventive care, diagnostic imaging, physical therapy, durable medical equipment, chemo, radiation, dialysis, and outpatient surgery, probably more things as well. Most preventive care services that fall under Part B are covered at 100%, but everything else will be subject to the Part B deductible and coinsurance. Medicare designates the Part B deductible for each calendar year, and it tends to increase it a bit every year. In 2022, the Part B deductible is $233, and thereafter Medicare pays 80% of your Part B medical care, and you pay the other 20%. And here's where people get confused because we aren't used to paying a deductible before our doctor copays are covered. Here's how the Part B deductible works. At some point in any calendar year, you will have to schedule your first Part B medical outpatient service of the year. For most people, it's whenever you have your first doctor visit for that year. However, your first healthcare service of the year might be lab work that you go and have done prior to a doctor visit, or some physical therapy because you have ongoing schedule of PT visits after maybe a surgery or an injury that occurred the prior year. It could also be something like a refill on your oxygen from a durable medical equipment vendor. In essence, the deductible will be applied by Medicare to the first bill it receives for a Part B service in a calendar year. So let's say that your physician sees you in December and schedules a CT scan for you on January 10th. When Medicare gets the invoice for that CT scan, it will see that you have not yet met your deductible for the year. It will apply the deductible to that invoice, which means it will short pay that invoice by $233, and if anything is left over, it will pay 80% of the remaining charge. When the diagnostic imaging facility gets the short paid payment from Medicare, it will see that it needs to collect that Part B deductible from you, and it will send you a bill in the mail for that deductible amount, and also for 20% of the remaining charges after that, if there were any. So what's important to understand here is that you don't pay the deductible by sending $233 to Medicare itself. You just pay the first $233 of your first Part B medical care in that year. This means you pay that deductible to a medical provider, and like I said earlier, it could be a doctor, it could be a diagnostic imaging center, like in my example. It could even be an outpatient surgery if that's the first Part B care you receive in that calendar year. Whichever invoice reaches Medicare first that year. Now, sometimes your first Part B care of the year is a simple visit to your doctor. And if the Medicare allowed rate for that service is not higher than the Part B deductible for the year, you may end up paying that deductible over a couple of services. For example, if Medicare allows the doctor to charge you $100 for your visit, then Medicare will apply that deductible to the bill and your doctor will bill you for the $100. But now you still owe the rest of the deductible in 2022. Since the deductible is $233, you still have $133 to go before Medicare starts paying 80% of your outpatient care. Let's say that you then go in for a specialist visit 2 months later. The specialist bills Medicare, and Medicare will apply the remaining deductible charge to that second bill, short paying it by $133 before paying 80% of the rest of the charges. The specialist will then send you a bill for that $133 and 20% of any remaining charges. Once you pay that second bill, you have now satisfied that entire Part B deductible for the year. Now for the rest of the year, Medicare will pay 80% of your Part B expenses, and you pay the other 20%, or more likely, you will have a Medigap plan that pays that 20% for you. And that, folks, is how you pay your annual Part B deductible. If you have a question about this, drop it in the comments below. And to learn more about Medicare deductibles and copays, check out this video next.